Hi, Rebecca. My name's Katie. I'm going to be your nurse today. Ashley's going to be your tech today. She'll be in here shortly to get your vitals. I'm going to ask you some questions for your admission and go over our whiteboard with you just so you're kind of familiar with the things in your room. So I'm going to put my name up here so you know how to get a hold of me. Our charge nurse name is Teresa today. And then your doctor is going to be Dr. Sum. And then Dr. Warman is going to be your orthopedic doctor. I see that your name is Rebecca. Do you prefer to be called Rebecca, or do you have a different name that you prefer to be called?
Becky would be fine.
Okay. I'll put today's date up here too, that way you know what date it is. Okay. Your room number is going to be 2146 while you're here. And then your room phone number to the black phone next to your bed is up here as well. Who would you like to be your family point of contact while you're in the hospital?
You could do my husband, Bob.
Okay. What is Bob's phone number?
317-601-1367.
Perfect. What brought you to the hospital today?
I had a fall and I hurt my hip.
Which hip is it? Is it your left or right?
It's my left.
What matters most to you right now?
Probably my pain. I'm having a lot of pain.
Okay. Do you have any questions for your care team today?
I'm just kind of wondering if I'm going to have surgery or not.
Okay. And a little bit about this whiteboard, we use that as a tool to communicate with you. So you'll find answers to a lot of questions that you might have. So we'll ask you every day while you're here, and then we'll update your care team. We'll go through your daily care and your pain management. So I know that you're in pain right now. What would you say your pain level is on a scale of 0 to 10 right now?
6.
Is 6 tolerable to you, or is there a number that's a little bit more tolerable?
A tolerable would probably be a 4.
So we will do our best to try to make sure that you're staying around or under that 4. We want to make sure that you're as comfortable as possible while you're in the hospital. Your doctor has some Norco ordered for you, and that would be for a pain score of 4 to 6. And then you can have that every 4 hours as needed.
Do you know when my last dose was?
It looked like you had some in the ER right before you came up. So right now it's about noon, and it looked like you had that around 11.
Okay.
So you can have that again around 3 o'clock.
Okay.
So I will write that up here too. That way you know when your next dose is available. So every day that you're in the hospital, as long as you're able, we would want to make sure that you're out of bed. I know your hip is hurting right now, and they're talking about maybe having to do surgery. So at this time, the doctor has you on bed rest, but once you're off bed rest, we'll want to make sure that you're up and out of your bed every day. So when we are updating your board daily, we'll update this out of bed section. And then we'll want to make sure that you're getting your appropriate oral care. So making sure that you're getting your teeth brushed every morning and evening. That helps prevent pneumonia. And then we will want to make sure that you get cleaned up, so get a bath every day. So your tech will update this section of the board when they visit with you each day. They'll write when you had your last bath and when you will have your next bath. That way we're all on the same page. Once you are cleared by your doctor, therapy will evaluate you if the doctor asks them to, and they'll keep up here how often they're going to treat you. That way you know the next day that they will be back. Right now, since they're thinking about possibly having to do surgery, they're going to have you as NPO, and that stands for nothing by mouth. So we don't want you to eat or drink anything. Once we do get you a diet order, there's a number up here that you would call with your room phone. And then if you dial all of those digits, you can also call with your cell phone if you prefer that method. Since you fell and you hurt your hip, we want to make sure that you're not having any more falls and having any more injuries. So we would consider you a fall risk. That means that we don't want you getting up without help from one of our team members. We'll keep your call light next to your bedside table. That way you have easy access to it, and if you need any assistance from one of your care team members, just let us know and we'll help you. So I'm gonna check up here that you are a fall risk right now, just so your care team is aware. And then on admission, we kind of like to talk about discharge planning from the beginning. That way we're kind of shifting gears and making our way to getting you home safely. On the day of discharge, there's some criteria that you have to meet to be able to go home. So we'll have to make sure that the doctor has a discharge order for you. Once they come by and clear you for discharge, they'll put the order in the computer. Then your nurse will be responsible for going over your follow-up appointments, medications, and any kind of home health or wound care treatment that you might have on discharge. And then before you leave the hospital, the last thing that we would do is take out your IV. We also have up here some reminders for you before you leave the hospital. We want to make sure that you have all of the personal items that you came with. So please keep those in a safe place and make sure that you gather everything before you leave. We want to make sure that you have a safe ride home, and then we want to make sure that you understand all of your discharge education. Do you have any questions for me right now?
Not at this time, I don't.
Okay. Let me know if you need anything.
Thank you.